Coronavirus hits overwhelming hospitals across the U.S., here in Illinois as well, and we might not even be at the peak of this Omicron variant.
Yes, Tia is back now with a closer look at these numbers. Tia?
Yeah, we got to talk about the numbers because they are not good. It's not just a record number of patients. Hospitals are dealing with a ton of burnout and sick staff as well. Dr. Shikha Jain is here to talk more about this. Dr. Jain, it's always a pleasure to have you here on First at 4.
Thanks for having me, Tia.
Let's get right into it. You're in the hospital almost every single day. What is that environment like as we see these hospitalizations go up?
So we're seeing lots of COVID cases going up. And as you said, hospitalizations across the state are really at an all-time high. And remember, these are not just COVID-19 patients. These are also patients who are having heart attacks, who are admitted with flares of their diabetes, who have broken their bones, people who are having surgery. So it's not just the COVID-19 patients we're seeing. And then on top of that, we're seeing a lot of people who are on the staff at the hospital, healthcare workers who are out sick with COVID-19. So unlike in the past, right now what we're seeing is a huge influx of patients, and we're seeing a decrease in the number of staff we have to take care of these patients across the state.
Let's talk about the fact that when it comes to this Omicron variant, you hear from people out there all the time, oh, the symptoms are mild. It's not that big of a deal as compared to the Delta variant. What would be your response to that?
Well, I want to remind people Delta variant is still here. We are not only seeing Omicron. There is Delta variant still circulating, number one. Number two, if you are vaccinated and boosted, absolutely. Your symptoms will likely keep you out of the hospital. However, if you are unvaccinated, even with the Omicron variant, you can get admitted to the hospital. And as a physician, I will tell you, mild to me with COVID means not being intubated, meaning not getting that tube put down your throat, not ending up in the intensive care unit. So mild does not mean just a runny nose. If you are unvaccinated and you get COVID, you are still at high risk for getting admitted to the hospital. So mild is what we see in those people who are vaccinated and boosted and who don't end up in the hospital. The mild that a lot of people are talking about is still ending up with people getting in the hospital if they're unvaccinated. And again, pretty soon we're not going to have staff to take care of you in the hospital if all of our staff are also out sick with COVID-19.
Yeah, that seems to be the narrative at a lot of businesses around the country. Now, we have these new state contact tracing numbers showing that 40% of people with COVID think they may have caught it from school. Is that a concern? And what can parents and children do to be safe while at school?
So we know how to keep kids safe in school. We know that if you're wearing good masks, well-fitting masks, we know if we've got good ventilation, good hand washing, I think it is possible to keep kids in school safely. We've seen lots of schools around the country and even here in Illinois do it. There obviously are risks when kids take their masks off to eat. So you just need to make sure that those extra precautions are in place. I'm not surprised that there is that high number of people thinking that's where they may have contracted COVID. We just need to make sure that we are doing all of the risk mitigation that we know works. Good masks, getting vaccinated, good hand washing, good ventilation, and keeping distance as much as we can.
All right, as always, thank you so much for joining us, and thank you so much for breaking it all down for us.
Thanks for having me, Tia. Have a good rest of your day.
All right, you do the same. Sally and Anthony, I'll send it back to you guys.